Dental Occupations. I'm Mrs. DiCarlo. Follow me. Our classroom setting is pretty much like the traditional classroom setting. So we have enough space for students to work on their studies. And then we start into our clinical area. The first area I'd like you to see is in this little room here. This is our one of our radiography areas, I should say. So we have radiography machines that are connected to the wall. We also have radiography or an x-ray machine that's handheld and students can carry. It allows them to take x-rays inside of the mouth with film and put them in the correct position like you see here. If we move over to this part of the classroom, we have a full sterilization center. The sterilization center is completely operational like it would be in a real dental office. We can pre-clean, package, and sterilize instruments, which is very important now more than ever during the pandemic. So we follow all the CDC recommendations and all of our equipment is fully operational. We move to the center of our CLIG area. We have 4 complete dental treatment rooms. If you look in the treatment room here, you see that a student has this set up for a tooth-colored filling or a composite restoration. So they have it all set up, ready to practice real world. Moving to the operatory over here, this is getting more in depth to our radiation studies. So what you see here is a student has their computer with their x-ray sensor connected to the computer in the patient's mouth, ready to take a radiograph or an x-ray that immediately pops on the screen. So if you look on the screen here, you see this is what our x-rays look like in class. Students are not permitted to take x-rays on live patients, but the mannequin does simulate real world very well. We also have an x-ray machine here that takes an x-ray much like you see on the picture there. This x-ray machine is digital, so it's connected to the computer right over here. This is nice because from this area, the student can turn off the radiation, and if you watch the machine, they can simulate an x-ray. They can simulate an x-ray without any radiation. So they can position each other in here and simulate an x-ray and have a real world experience. The x-ray that will pop up on the screen for them looks much like this because our mannequin has metal inside of them, but it simulates as close as we can to real patient anatomy. Last thing I'd like you to see, patient has this treatment room, student has this treatment room set up with their patient for alginate impressions. So they're learning to take their alginate impressions on their patient. Once they're finished with those impressions, we move into this part of our classroom, which is our dental lab. They take those impressions and they learn to make and trim study models like you see a student working on here with this piece of equipment. And some other things that they do in this part of the classroom is learn to make custom trays, maybe for a denture patient, or whitening trays for a patient that wants to have whiter teeth. That's a quick synopsis of what we do in dental occupations. Thank you for visiting.
For more information about this program, please visit the program page at www.brookscareer.com.